In today's Eye on Health, when you think of cancer treatment, you likely think radiation and chemotherapy. But did you know the benefits of exercise are now being studied and praised?
And in fact, it's so important to doctors and researchers at Allegheny Health Network that they have built an entire facility dedicated to exercise oncology. As Daisy Jade tells us, it's not only impressive, it's groundbreaking. And that's today's Eye on Health.
The number of people that end up crying because they just feel so good is it's amazing.
Those people Dr. Champ is talking about are cancer patients taking part in programs at exercise oncology centers. The facilities are so unique, only 2 exist in the country, one in Florida and one right here in Pittsburgh.
Individuals with breast and prostate cancer during or after their treatment are sent to the Exercise Oncology Center to help with their side effects and also to improve outcomes. There are a lot of exercise research programs in the country, and there's a lot of oncology programs in the country, but not a lot of overlap. So this was basically started to fuse the 2 together.
Something else that is fusing together? The importance diet plays for all of us on the road to better health. Dr. Champ has a simple way to make good food choices.
Stay around the outside of the grocery store, stay out of the inside. Nothing your grandparents wouldn't recognize as food.
Dr. Champ was introduced to healthy living at a young age, helping his grandfather with his organic garden. The lessons he learned then are applied in his work at AHN now, making sure exercise is a key part of a cancer patient's recovery.
During the end of my training, there started to be more and more enthusiasm about using nutrition and exercise in cancer care. And so fast forwarding now, we're 15 years later, the relationship is huge, it's obvious, it's supported by a ton of data.
How does exercise benefit someone who's completed cancer treatment?
So you feel better, you move better, you sleep better. It helps with quality of life, it helps with the side effects of cancer treatment. It improves muscle mass, it decreases fat mass, and both of those correlate strongly with cancer-specific outcomes, especially, for instance, women treated for breast cancer. We know that if we improve those metrics, we'll be associated with longer survival and a higher chance of cure.
I wanted to learn about the core moves that patients at the new Exercise Oncology Center here in Pittsburgh will learn to do and learn to love.
So this is another basic core movement, a hip hinge. And this is a hex bar deadlift. And so it looks difficult, but everyone in our facility will end up doing this. It puts your weight a little far backwards, so it makes it a little safer than a traditional deadlift. And again, this is a core basic movement, a hip hinge movement. So this is going to help people with their day-to-day function. This is definitely going to help people decrease risk of falling. It's going to load the joints, it's going to load the spine, it's going to build muscle mass, and it's also going to build healthy bones.
We know exercise is good for all of us, but this center is providing a place for the patients who may need it the most.
For years and years and years, we've told individuals to exercise at home, but we don't know what they're doing, we don't know if it's safe, we don't know if it's the most effective exercise regimens you can get. So right now, these patients come here, it's all under our roof, we observe everything, and then we do a whole slew of measurements to ensure that they're improving. We've been fearful, for instance, women with breast cancer, we're fearful about things like lymphedema, and it's understandable why we were, but we're beyond that. And so now it's up to us to push these individuals to make those changes. So that's number one, and that's number one of our research, is showing that we can get the benefits in a cancer population. There's nothing different between someone with or without cancer if we use the appropriate metrics to push them.
Exercise oncology is giving cancer patients more than just a push. It's giving them a new lease on life.
They can expect to get a lot stronger, initially to get sore, but that'll pass. To move better, to feel better, to sleep better, and really just overall feel absolutely better as a human being.
Isn't it interesting that we know the basics that are going to make us feel better, eating right and working out, and yet we so often put those, we were just talking about it as we were watching that.
It's hard.
We put it on the back burner, but it's so neat to see that this is happening right here. And for more information on the services at the AHN Exercise Oncology and Resiliency Center, you can go to PittsburghTodayLive.com.
And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.